Jay Swaminarayan, and welcome to the BAPS Campus Podcast, a podcast aiming to share insights from various industries such as medicine, finance, and aviation. Every episode, we will invite successful satsangis to share industry insights, trends, and how they have navigated their careers. This week, we will dive into the world of medicine and look at COVID-19, living in the shadow of the virus. This week's podcast is hosted by Kishan, who is a second-year medical student at the University of Nottingham. Our guest today, Dr Mit Dattani, is a consultant in general surgery. Having received Ashirwad from BAPS Swaminarayan, Mit Dattani started his journey into the world of medicine in 2000. After graduating from the University of Leeds, Dr Mit Dattani has gone on to work at a number of hospitals across the country. He now works at the NHS University Hospitals in Birmingham.
We've kind of noticed that in patients who've recovered from COVID-19, they have come forth to discuss the long COVID effects that they've been experiencing for months after discharge from hospital. You know, the brain fog, the weakness, the breathlessness.
Yeah.
So officially termed post-COVID syndrome by the NHS. Is this something to be concerned about?
I think so. I think we're not, it may seem that, we've been battling with this for almost a year now, but I don't think in the chronicity of medical conditions, I don't think, we're long into this, into the timeline to know the real impact and effect of a post-COVID world. But I think it's obvious that some patients who've obviously survived this nasty infection will have long-term chronic conditions. Now that may be because, they've sustained long-term damage in their lungs and may be breathless for a long time. But I know of people who've developed, pericardial effusions, who've had trouble and will need, regular monitoring for their heart. And as you mentioned, some people might have developed, blood clots. We know it's a prothrombotic condition, and lots of people have developed DVTs or pulmonary embolysis. But we just, this morning I read about, an increase in inflammatory syndrome in children. Yeah. Lots of children being admitted to Great Ormond Street. So we don't know. I don't think we know the real impact and effect of this, what's going to happen in the long term. And often, as you'll know, these things take there's a time lag before we can really appreciate the long-term effect on human health. But I do think that, and this is a personal guess and opinion, I think in the long run, there may be in certain individuals some long-term damage that will have been sustained. And I think there will be a whole discipline that will be raised in medicine, and people will be COVID specialists. Now, they may be respiratory physicians, or I think they may be just, doctors who deal with the long-term effects of COVID, post-COVID syndrome. I don't know, but I do very much think in ways that we don't fully understand and appreciate that this is here to stay for a long time.
I think that's very interesting what you mentioned, actually, especially the things that you've read as well about these, the fact that it's a pro-inflammatory condition, because a study was actually conducted with 68 pulmonary autopsies from New York City and Italy, and there were several biochemical and anatomical changes that they noticed inside the dissected lungs.
Yeah,
there was elevated D-dimer and interleukin-6 inflammatory mediators, as well as fibrosis of the lung tissue. I guess what my thinking was is that if these are the effects of COVID in the body, if this is its actual mechanism and the way that it attacks the tissues, maybe 15 to 20 years down the line, like you said, when we see even more deaths from this virus, is this a really quite sinister shadow of the virus?
But probably, I think so. I do believe, lung fibrotic changes perhaps will stay on, may get worse. It's difficult to know, but I do think, 1 year is a very, very short term. I think, we've obviously lost, millions of lives to this, but the people who have survived, we have no idea about the long-term significance and impact, which again, all the more reason that people should be, because, people think I had COVID, I survived, it's okay, I'm immune now. But we just don't know what the long-term effects are.
It's certainly very fascinating to think about, right? But yeah, I suppose it's a major area of medical research that will, like you said, begin to grow and may even form an entire discipline or specialty out of it. So, for all our medical students in the audience, maybe about 15 or 20 years down the line, they might be consultants in COVID. Who knows?
Yeah, no, I completely agree. Yeah, I think so. It's fascinating but frightening at the same time.
Yeah.
That a specialty may be born out of this infection. And I think we may forever, as you said, live in the shadow of this, and it's completely unprecedented. That something nobody saw this coming at all. But it's taken. I mean, everything else has been parked aside, and this has completely taken over our lives. And I think it may linger on for longer than we think. So we just have to adjust and learn how to live with it.
So, for your patients personally, as like you said, because everything else has kind of been parked to the side, have they kind of felt the impacts of this as well? I mean, I imagine there's been some quite serious effects on especially the cancer treatment of cancer as well.
No, absolutely. I mean, the collateral damage from COVID, I don't think has been measured, or is still being measured. The fallout from this, the impact. We're only focusing on health today. We're not going to focus on any other industry. I'm sure you'll touch on those things in future podcasts. But just the health and well-being fallout, because the entire resources and manpower of the National Health Service, and for many health services across the world, has been sucked up by this terrible and tragical virus, has left every other medical specialty completely sort of exposed. Just a couple of weeks ago, in Lancet Oncology, was a publication about a population-based study about colorectal cancer treatment and how it has been affected because of the COVID pandemic. So at the end of the first wave, April, May time, about a third less, so about 31% of colorectal cancers had not been operated on.
Wow.
That's the end of the first wave. Now you add the effect of the second wave, the third wave. That's not taking into consideration the problem with diagnostic tests, the people who couldn't go and see their GPs, who couldn't be then referred to 2-week wait colorectal clinics, the people who didn't get their colonoscopies in time, the people who didn't get their diagnosis, etc., etc. These are people who know they've got cancer, who need an operation, who've got operable cancers, but a third of them did not get their cancers operated on. And you will know, and your audience will know, that conditions like cancer are time-critical health conditions that need treatment in a time-critical fashion, because the longer you wait, there's a risk that these cancers will spread, or if not, they will become inoperable because they're locally advanced. But so the fallout from this and the effect, and this is just cancer, but you think about all those benign conditions that have a significant impact on people's health and quality of life. All those hips and knees that needed replacing, the people who can't walk or are struggling at home, are dependent on painkillers, who you can't get out and about, who can't climb a flight of stairs. Think about all those millions of people who missed out on operations that they needed doing, not necessarily for cancer, but improving their quality of life. And I don't know how we catch up, if we ever catch up. So it's significant, and some things have never been measured. The impact will never be truly and fully be appreciated, I don't think, anyway. We can hazard a guess, but you can only measure what you can.
It's just incredible how quickly this virus took over, and it took the NHS by storm, and
absolutely
every other medical specialty has kind of suffered for this, and it's as if the pandemic itself has now created a whole separate set of individual epidemics now. We'll see epidemics in cancer, epidemics in other specialties, endocrinology or whatever it might be.
Yeah, no, I think you're absolutely right, and that's the word. I think you hit the nail on the head. You will create epidemics in other health-related problems.
Well, we like to think that, the NHS could play catch up quite fast, but I suppose we'll have to see. Like you said, we'll have to see the long-term fallout of this. And, I think the uptake of the vaccination program might be a key factor in that. So,
Yeah,
again,
the problem is you've got finite resources. You've got finite hours within a day. You've got finite resources within the NHS or any health service for that matter. You've got a finite number of doctors. You've got a finite number of operating and diagnostic, slots. There's only so much you could do. Even if you possibly couldn't work 24 hours a day to play catch up.
Yeah.
And like I said to you, some of these conditions like cancer are time critical. So you might say that we'll get to do your operation not next week as was planned, but next month. But next month, the patient may have developed metastasis and the cancer may have spread and is inoperable now. So it's worrying. It truly and genuinely, if and we will all have friends, families, we will know people whose friends and families will have these diagnoses and will need this time-dependent interventions that will not get them in a timely manner.
Certainly, yes. And I suppose all we can do is just pray that this will be resolved eventually, I suppose, and that we can see the end of this virus for good. So kind of moving on to a final question now, final discussion point. Just for the benefit of all our medical applicants, the students in the audience, it would be nice to discuss the impacts of medical education to kind of tie everything together. So in March of 2020, we saw 5,500 final year medical students graduate early to enter the NHS workforce to assist in the first wave. As a consultant now, having gone through all of those stages of training, how do you view this? Because from the perspective of a student, I see it as like this incredible, unmatched learning experience with the ultimate level of clinical exposure. So, will the pandemic alter the way we train our doctors? Right now we have this traditional preclinical years and then clinical years split. Will this alter the way that we train our doctors?
You mean in what setting? What do you mean?
In the sense that will they should the system be effectively clinical exposure from day one to train them? Because a lot of these final years that now come out and say that actually this was probably the most incredible level of clinical exposure they could have received, more than they would usually receive, and this has helped to consolidate a lot of their clinical competencies. So would it be better to start this from day one, kind of like an apprenticeship style degree where the learning is on the go?
Yeah, I think the purists would probably argue it differently. I mean, I'm no expert in medical education, but and I know different universities in the UK and across the world will have different ideas about how we should best train our doctors. But I think the competency model is gaining a lot of traction. I think, an apprentice type model, and that's what it used to be. There used to be an old adage: see one, do one, teach one.
Yeah.
I don't think that's necessarily the right way to do things, because I think it is unsafe and it exposes patients to unnecessary dangers and probably increases the anxiety with medical students. But I think there is no harm. I think medical students are quite mature, and I don't think with the right guidance, we can't allow them to see and interact with patients. From pretty much early on in the first year of their clinical training. But you're right. I think it was very, very refreshing and quite a nice thing to see that medical students in their fifth year were graduated early, and a lot of them stepped up. I saw lots of them coming to St. Mark's, and some of them were involved, in the front line. Others did things behind the curtains, and they made a huge difference to improving sort of patient care, patient satisfaction. Some of them were sort of liaison officers, and I think some of them still are in certain hospitals, whereby they're using medical students to call families of patients who are in the ITU to save the doctors who are actually treating the patients to continue doing that. So these people will make the phone calls to family, answer the questions, will attend the ward rounds, will attend the handovers, and these are the sort of things that I think can be done in a safe environment under good supervision and training. And I don't see any reason why medical students can't be let into the arena much earlier on. But I think everybody will have a view on that, and we've got to remember, it isn't only COVID that medical students need to learn and get used to and treat. You will still need these medical students to rotate to various disciplines and specialties, But I don't see any reason why people can't come on the ward much earlier.
Certainly, yeah, and hopefully, I think from the perspective of students, I think they'd love to see that change in the course. But as you said, I think there's a lot of factors to consider.
Yeah.
Certainly, a lot to consider with respect to that. I think now, just final thing. Do you have any messages for our aspiring medics in the audience? With all your experience, what would you say to them, applicants and students?
Look, the first thing I want to say, it's a very, very rewarding career. It's a long journey. It's a difficult career, depending on what you want to do in medicine. Medicine is so vast. So depending on which specialty takes your fancy and what you want to do. Medicine is above everything. It is a rewarding career because you are helping people when they're at their most vulnerable. No matter who you are, when you're unwell, when you're in hospital, or one of your loved one, your family or your friend is in hospital, it's a very, very difficult time. There is a mixture of emotions that you go through. Some people are anxious, they're worried, they're fearful. A lot is at stake. Even if it's not a life-threatening condition, you're in pain, and it's not a great place to be. So people are they're most vulnerable, and I think for a medical specialist, and that doesn't have to be a doctor necessarily, but any medical allied professionals to step in and make a difference, even if you can't save this particular person, if it was a life-threatening condition, but you can make them comfortable, you can reassure them, you can help them, you can help their families. It is just the most rewarding and the most satisfying experience that you can ever get. And I think most people who go into medicine go because of that sense of pride that I have made a difference to somebody or somebody's family. So I think go into medicine with that feeling, and then everything else will be offset by that. Is it difficult? Yes, it is. There's lots of exams. There's lots of hoops to jump. It's a long career. It can be financially very, very challenging. It was financially challenging for me. I had to move 10 houses, 4 different regions in the country. It takes a toll on your family. It takes a toll on your relationships. It takes a toll on your satsang. I was away from a center for almost all 14 years of my training. There was nowhere that I was that there was a mandir. But you do it because you want to get there. And I remember in 2000 when we went to see Swami in 11 Kishores had gone from Leicester, and we met Swami on New Year's Eve in Gondal, and there was a Kishore with us who was going to do a placement at Novartis, which is a pharmaceutical company in Basel in Switzerland. And he asked Bapa for Ashirwad because when he was going to come back within a few months, he was going to go to Basel for a year. And I distinctly remember this. Bapa was in his room. He was sitting in a chair, and Bapa gave him a dabbo. And Bapa said to him, gave him Ashirwad, but Bapa said that you can go to study or work. He used both. He said, you can go to study or work in any part of the world, he said. He said, gamme te jaano. But he said, niyam dharma, puja pat, you stick to that. So you can go anywhere in the world, but as long as you maintain your niyam dharma, you do your puja, you have that joran with the Satpurush, with Mandir, you'll be fine. So coming out to the point, it will take its toll. You will be away from your family. You'll have to make lots of sacrifices. You may be on call during your birthday. You may be on call during your wedding anniversary. You may be on call during a major samayo. You may not be able to go to India for a big samayo because you can't get that swap, or you can't attend a particular event in Mandir. So all these things are sacrifices, are prices to pay. But ultimately, the most rewarding thing is that you make a difference to somebody when they're at their most vulnerable. You won't become a millionaire, but that's the satisfaction. This is what Bapa's motto, Bapa's biggest. Well, if you ask anybody, what's Bapa's mantra? In the joy of others lies our own. When I see a child, 9-year-old who comes in with right side abdominal pain, and they've got appendicitis, and they're in pain, they're not very well, they're cranky. The parents are worried, because they have the worst fears in their head. But when you take that appendix out, an operation that takes an hour, 45 minutes, and you go and see them the next morning and you ask the child, how are you feeling? And everybody is suddenly happy, they're much more content, they're much more reassured. The weight has been taken off their shoulders. You know when you leave that hospital that you have made a difference to somebody's life when they're at their most vulnerable. And that's what medicine is. It's about helping other people.
Well, Amit, but I think we really, really appreciate the honesty on that. And I think you've really highlighted some really key aspects about medicine, the compassion, the fact that in the joy of others lies our own. I think that's a fantastic note to end on here. But, I think we've covered a lot of ground in a short time. And, I do sincerely believe that I think the words of advice and I think your opinions and everything, I think that will really inspire our Gishwas in the audience. If anyone's there thinking about applying for medicine, I think this is a fantastic way to convince you to do so. And I think, Midbhai, thank you so much for joining us. We really appreciate it. And I think we can all take away quite a lot from this podcast. So thank you so much.
No problem at all. It's a pleasure. Anytime.
That concludes this week's podcast. We hope you've been able to take something meaningful away from this discussion. Jai Swaminarayan.